Hi everyone, I'm Michael Uriarty, or Dr. Mike, and welcome to Technique Talk, the MYK System, and more. This is episode 23 in our series of comparing and contrasting other techniques with the MYK System. Today, we're going to talk about postural restoration. If you have, or if you want more information on either technique, I have the website links in the description below. Hey, if you haven't subscribed, be sure to hit the subscribe button. I have a lot more videos coming. Whether you're a patient looking to get help or a practitioner looking for a good technique, this series is what you need. Let's dive in. All right, so let's look at first who developed postural restoration. And so I went on their website and it says Ron Hrska. I'm going with it. It's H-R-U-S-K-A. H-R-U-S-K-A. So I'm saying Hrska. I could be way off with that, but that's how I'm pronouncing it. So I'm going to call him Ron. How about that? But he gave a little description here of what got him interested in forming this. And he said, after 16 years of hospital and outpatient-based care, I knew I had reached a significant point in my career when a majority of my patients reach optimal functional outcomes through the incorporation of left acetabular femoral internal rotation, the isolated facilitation of left femoral adductors and left thoracic abductors, the establishment of a left zone of opposition, and the enhancement of right brachial expansion. Well, I haven't taken the class, so I don't know what that means. So that's, but it sounds interesting, but I haven't taken the class, so I have no idea. But he goes on, he goes, it was often difficult to convince physicians and physical therapists to reposition a pelvis and a femur before stretching out an iliotibial band or performing an iliotibial band release surgically. That's why I established a private practice and the Postural Restoration Institute. So, interesting. That's interesting. I like the little history there. I always like finding out why people developed what they developed, and so and what got them interested into healthcare. You know, my story was I was 10. I was 10 years old, one shoulder higher than the other. I couldn't raise my arm without crying. You know, ah! And I went to my dad. Dad, look, ah! And he goes, don't raise your arm. I'm like, ever? I'm 10. So I did what any kid would do. Mom, Mom, look. Ah. And we went in and saw a chiropractor. He adjusted me, and I was thoroughly impressed. And I could raise my arm right afterwards. And I knew at that moment that's what I wanted to do. So I've known for a long time that I wanted to be a chiropractor. And then working with a lot of massage therapists got me into developing the myokinesthetic system and working with the soft tissue to balance out the body. So let's get into kind of the core concepts of both the myokinesthetic system and postural restoration. So if we go with postural restoration first. So it says the Postural Restoration Institute focuses on the science of postural adaptations and asymmetrical patterns in the body. The human body is not symmetrical. The neurological, circulatory, muscular, and visual systems, just to name a few, are not the same on the left side of the body as they are on the right. So postural restoration aims to help professionals recognize this underlying asymmetry of these systems in our body and the postural imbalances and patterns associated with dominant, unconscious, or conscious overuse of one side of the body. And then it says our right side. Unless, of course, I'm assuming you're left-handed. Then maybe you don't. But maybe you do. Maybe everybody overuses the right side. I don't know what their philosophy is. I haven't had the class. So the core concept of the myokinesthetic system is, number one, we got to get people out of pain. That's the very first thing that we do. And that usually happens very quickly, 1 or 2 treatments. Normally, we can get people out of pain. And then we got to work on balancing their postures. And if we balance the posture is the outward expression of the nervous system. If we balance the posture, we balance the nervous system, and therefore the body starts to function the way it's supposed to function. Pain goes away, range of motion goes up, health gets better, allergies disappear, all that kind of good stuff. You can prevent injuries, things like that. And so that's kind of our thing. So if we go into the treatment approach for postural restoration, it uses manual and non-manual techniques to restore proper alignment of the body while proper respiratory dynamics are considered. All right, that's interesting because that's a question that I get a lot is, do you incorporate breathing in with your treatments? I don't. I tend to do my movements when I'm working on a muscle or something. I tend to go fairly quick. And so I'm not going to, my patients would hyperventilate. If I got in and said, okay, we're going to move your arm back and forth, they would pass out. And so I'm not going to do that with somebody. So I don't get into the breathing aspect. That's not my thing. I just do the treatment. So maybe there's a difference in what we're trying to do. All of our treatments are 15 minutes or less, depending on the nerve level that you're going to treat. And so if you're doing a headache, for example, that's about a 3-minute treatment. If you're doing like plantar fasciitis, that's a 15-minute treatment. Shoulder issues are usually like 10 minutes or so. So it just kind of depends on what you're treating, depends on how long the treatment is going to be. And then we have continuing education. So they offer 12 postgraduate level courses and an annual interdisciplinary studies summit. Their primary course, they have posture restoration, posture respiration, and pelvis restoration. And then they have some secondary and tertiary courses as well, and they kind of listed some of those out. And so with us, we have, with the myokinesthetic system, we have the upper body, the lower body, and the autonomic nervous system. And that's the 3 that we have right now. And we cover, I'll just give you the upper body. We cover 84 different muscles, 21 different nerve pathways. There's 9 different nerve roots, but it goes out into the different nerve pathways. And 112 different symptoms that we can treat. And we learn 33 different movements and combine that down into 9 different treatments based on what's going on with a person. So that's kind of how we go through things. The target audience, they go after licensed healthcare and certified fitness professionals. Oh, that's good. Okay, so they go after the fitness industry as well. We're pretty much, there's 5 core. We have a lot of different professions that have taken it, but there's 5 core healthcare professions that we teach. So we got the chiropractors, the physical therapist assistants, occupational therapist assistants, athletic trainers, and massage therapists. So I started out the first number of years, I only taught massage therapists. And then I kind of started branching out into the other professions. So let's see. Key concepts that they emphasize is that the body is inherently asymmetrical. So the influence of systems, the neurological system, the visual system, the stomatognaathic. Okay, so here's a question, and I'm just going to throw it out there. Don't Google it. Don't Google it, but put in the comments below what you think stomatognaathic is. Now, if we were to pronounce it how it's spelled, it would be stomatognaathic. Stomatognaathic. Maybe that's how you say it. I have no idea. But I think it's stomatognaathic, but stomatognaathic. But what do you think it means? Because when I teach, if I throw out a word like that, I then put what the definition is, or I say what the definition is. Because for me personally, I don't like going to a class. This is just my personal thing. I don't like going to a class and people use big words that you don't use on a regular basis. And so if I'm going to say a word that is not used on a regular basis, I then define that word so that nobody has to think very much and they understand everything that's being said in the class. That's how I like to teach. That's how I like to be taught. And so, anyway, that's just my little thing. All right. All the courses are taught by me for the myokinesthetic system. So right now, I am the only instructor of the myokinesthetic system. I am also an instructor at the University of Idaho in their master's and doctorate program of athletic training. I've been doing that for about 11 years. And so that's a pretty good thing. I like being connected with them. They do research on the technique, and they continue to do research on the technique. And so that's been very good. With Postural Restoration, they have a lot of different instructors. I went into their staff, and they had a ton of people. If it says our staff, there's like 5. It says our faculty, and I guess these are the teachers. And then they have faculty in Japan, so they have a whole thing over in Japan. So that's kind of cool that they have a whole series or a whole school. Classes going on just in Japan. So that's kind of nice. So they have a big group and a number of people that teach. But Ron is not the only instructor. With my stuff, I'm the only instructor right now of the myokinesthetic system. So they say recent insights. This is just something so recent postural restoration social media posts highlight concepts such as if the inlet is in abduction, the outlet is in adduction on the same side. Well, we would have to know what the inlet and the outlet is as far as what they're talking about. And without that, I can't give you any guidance on what they're talking about for that. So anyway, let me see. What else do we have down here? Okay, let's look at this. What are the core principles between the two? So myokinesthetic system focuses on identifying and manipulating specific muscles to balance the nervous system, to relieve pain very, very quickly, and restore mobility very, very quickly. So we get those two things going very, very fast, okay? It operates on the principle that the nervous system problems affect all other systems of the body, which is true. The nervous system controls everything. So postural restoration, on the other hand, emphasizes understanding and addressing asymmetrical patterns in the human body, recognizing that neurological, circulatory, muscular, and visual systems are not symmetrical. Well, the visual system better be pretty darn close to symmetrical, because if you got one eye going this way and the other eye's not, you're going to be falling down or being sick. So your eyes have to move together. That's how we're made. We're not like those little lizards where one eye goes this way and this eye goes that way. We got to be keeping our eyes together. So I'm not really sure about that. But anyway, like I said, I haven't had the information. If you've had the class, I've heard good things about it. That's why I wanted to do a talk on this. I've heard very good things about it. So I just don't know some of the stuff. So if you've had it, put some information in the comments so that we can learn a little bit more about what's some of the stuff that they do here. So it aims to restore, this is postural restoration. It aims to restore proper alignment and function by considering all mechanical influences on the body, with particular attention to respiratory dynamics and patterned adaptations. Okay, so that's kind of cool. Let's see, the core educational and certification opportunities offered by both. So we have 3 courses, the upper body, the lower body, and the certification course, the autonomic nervous system course. And completing all 3, then you become certified in the myokinesthetic system, or the MYK system. Postural restoration, there's 12 different classes, and you can get postural restoration certified, you can get postural restoration trained, you can be a postural restoration provider, and also do all this in Japan. Okay, yeah. What are the types of conditions that we treat? So with the myokinesthetic system, we treat a lot. So, we've got headaches, carpal tunnel, rotator cuff issues, frozen shoulder, tennis elbow, golfer's elbow, sports injuries, plantar fasciitis, sciatica, shin splints, knee issues, low back pain, peripheral neuropathy is huge, acid reflux, asthma. There are a lot of things. Oh, incontinence. All those things, we get phenomenal results. Everything that I just named off, we get phenomenal, fast results with all of those, okay? And there's more. I just didn't even name everything. So postural restoration addresses underlying biomechanics that can lead to various symptoms of pain and dysfunction by addressing the human body's natural asymmetries. Common issues include breathing difficulty. They focus a lot on the breathing. I find that interesting. I do like that part of it. So they include breathing difficulties, postural imbalances stemming from a dominant side overuse, which we do. Think of a tennis player or a baseball player or a factory worker where they're doing the same motion. They're going to have that dominant side overuse all the time. So I see that. And then other movement restrictions. And it can help a number of problems arising from imbalances, including Kimberly William Paisley's vocal rehabilitation. Well, I don't know Kimberly William Paisley, so I have to look that up. So, again, who teaches it? I teach the myokinesthetic. They got a bunch of different people that teach postural restoration. And so, again, they have it broken out into primary courses, secondary courses, and tertiary level courses. Let's just say if they have 12 courses, let's say they got 4 primary, 4 secondary, and 4 tertiary level courses. So the primary courses, I see. So the primary courses, there's 3. They're introductory and don't require prerequisites. It's generally recommended to begin with either postural respiration or myokinematic restoration. And then the secondary and the tertiary courses have prerequisites for each course. So with us, you can take the upper or the lower. With the myokinesthetic system, you can take the upper or the lower first. It doesn't matter. But you have to have both of those before you can take the autonomic nervous system, because the autonomic nervous system builds on what we've done in the upper and the lower. Where can you find a practitioner? So if you go to the myokinesthetic system website, up at the top it says find a provider. For postural restoration, the Postural Restoration Institute provides a search tool on their website where you can search by location, specialization, and type of provider. All right, pretty cool. So, like I said, I've heard a lot of really good things about the postural restoration technique. Both the Myokinesthetic Institute and the Postural Restoration Institute offer distinct approaches to understanding and treating pain and dysfunction. So MYK's rapid treatment and emphasis on nervous system balancing through muscle manipulation, along with a comprehensive systems-based approach, may appeal to practitioners seeking quick and effective solutions. Postural restoration's focus on managing asymmetry may attract those seeking a deeper understanding of postural patterns and their impact on overall function. So both institutes provide valuable continuing education opportunities for professionals aiming to enhance their skills and improve patient outcomes. I like that. Okay. So that was not bad. That was a pretty good intro there for those. So let me know if you have more information on the postural restoration technique. If there's anything that I said that was not correct, put it in the comments below, because I'm always looking to learn more. I'm always wanting to find out more. And if you made it this far, smile.